Hi, my name is Jillian Geiger, and today I'm going to be redoing my catheterization, my indwelling foley catheter insertion. So I have entered my patient's room. I have already performed hand hygiene, but I will perform it again. I have introduced myself to the patient, verified name and date of birth. So the two identifiers, I have assessed level of consciousness, pain level, any concerns regarding the procedure. I have explained the purposes of the procedure to the patient. She is free of any questions. So now we are going to begin with the catheterization. First we are going to take the blanket. Now typically it would be a sheet, but on this bed for this demonstration, the purposes of this demonstration, it is going to be this blanket. I could not find a sheet to switch out, so it's just going to be this blanket. I do understand that in a real patient's room, I would not use the blanket, but I'm going to put it into a diamond shape, being sure not to fluff it or anything like that. And then I'm going to get the patient to lift her legs, bending them at the knee. And I'm going to gather up the corner and wrap the sheet around her ankles. That way, whenever it's lifted up, there's a clear pathway to see the area. Obviously this would be a little bit easier on a real person, because the patient would be able to help a little bit, but that's okay. This foot is giving me some difficulty. Okay. There we go. But you are going to wrap this around and have it underneath the foot so that the foot can secure it. And that way, when it's lifted up, you do have a good clear view. So now, and I would have gloves on for that portion of the procedure, but I do only have one extra pair of clean gloves right now, so that is why. But now I would typically clean the area with soap and water, so that way I can make sure that there's no cross-contamination or anything like that whenever I go to insert the catheter. And I would do that with gloves, and I would have the supplies for that. But now I would take my gloves off and discard them in the trash receptacle, perform hand hygiene, and now I'm going to begin with my catheter kit. Move this around, make sure you can see me. So typically it would be unopened, but right now we do not have any that are not unopened, so we're gonna pretend. So I would open up and take the contents out. And fold this over to create a trash bag that I am going to put at the end of my patient's bed, so that way I will not be turning my back on my sterile field. Sorry, I'm just trying to get this straight. And now I'm going to begin with orienting myself and opening my container, just like that. And now, in order to maintain sterility with my gloves and my hands, etc., I'm going to put on some clean gloves really quickly. So these are not my sterile gloves, these are my clean gloves. And I'm going to grab the drape by the 1-inch border so that way, with the shiny side down, so that way I can put this underneath my patient and it will not make my sterile gloves non-sterile. So with the patient, I would just ask her to lift up her hips. I'm sorry, I was slightly in the way of that, but the drape is now underneath her. And now I'm going to discard of my clean gloves, perform hand hygiene, and now pick up my sterile gloves, and I'm going to do this on the bed for the purposes of this video, so that way you can watch me put them on. Grab the cuff and orient myself to this messed up glove. I'm going to switch hands because it looks like somebody has put this in here backwards. Would not do that. And then come underneath the cuff and put this on. Typically I would discard of this. I'm just going to set it off to the side. Excuse me, my computer is fading. That is why I keep coming over here. I do apologize. Do not want the video to cut off. So now I would not touch my hands or drop them below my waist level. I'm going to come over here and grab the drape that will be going around the labia or around the external vagina, and making sure that the shiny side is always down. Okay. And situating this just like so. Okay, and now I'm free to touch anything in my container. So I'm going to pick up my sterile swab sticks, wiggle them out, discard of the in packaging, do that again, wiggle them up. Okay. And I do have the lubricant that I'm going to put at the bottom of here for the end of my catheter. I'm going to take this off. I'm going to put this at the edge of the bed so that way I'm not moving around a lot while trying to take care of my patient. Going to find the end of the catheter. Now typically this would be wrapped up obviously in plastic. Again, just have my computer because it's fading. This would be wrapped up in plastic and I would remove that, but it's not, so I'm going to stick the edge of the tubing in the lubricant before I get started. And I'm also going to attach this, which will be blowing up the balloon, just like well. Let me make sure. Okay. It seems to be slightly pressurized today. There we go. Okay. And now I'm going to start with the cleaning. And then I'm going to be doing the outside of the labia, discarding, outside of the labia, discarding, inside on one side, discarding, inside on the other side, discarding, and straight down the middle and discarding. So now from there, going to make sure that my patient is ready, assess for pain again, I would make sure that I have already done that multiple times, but I would, before inserting the catheter, assess for pain again, make sure she's not in any pain, or if she is, then if she has a PRN pain medication that she would like, could administer that. So now I'm going to take my catheter, the tip of my catheter, and I'm going to hold the labias open. Well, I would be holding the labias open on a typical patient, but this patient, where her urethra is and her labia, they do not need to be held open, but I would hold the labias open. I just do not want to block you from being able to see this procedure because it is kind of difficult right now. I would not typically touch this straight, but I'm going to move it up right now, just like so. I would hold the labias open, making my right hand my non-sterile hand, and then I'm going to insert the catheter, twist it, inserting it until I meet resistance, and then what I'm going to do now is insert the balloon. So this balloon is a 5 milliliter balloon. Become 5 milliliters, 10 milliliters. This one is 5 milliliters. So I'm going to put 5 milliliters water into the balloon, and then remove it, discard, and then I would pull back on the tubing a little bit to hold it into place. Now I would take the catheter bag and hang it at the bottom of the bed on a immovable part, resituate the patient, and clip this onto the bed. Thank you.